Hello guys, welcome back to a new video of DocTalks India, where we are going to discuss about the types of shock in brief. So let us begin and let us start from what is shock. So shock is defined as the condition of depressed vital functions due to decreased tissue perfusion, which is as a result of decreased microcirculation. What are the type of shock? First, the hypovolemic oligovolumic kind of shock. So it is due to decreased amount of body fluid. Second one is cardiogenic. Third one is vasogenic, and fourth one is septic shock. Starting from what is hypovolemic shock? Hypovolemic shock is due to the result of decreased body fluid. Body fluid can be intracellular, extracellular. Okay, so here the amount of body fluid is going to get reduced. That's why there is a shock. So what are the subtypes of hypovolemic shock? It can be hemorrhagic or it can be non-hemorrhagic. Hemorrhagic due to any kind of loss of blood from our body due to an injury or any fracture. So that is called as hemorrhagic type of shock. What is non-hemorrhagic type of shock? So there will be a generalized loss of body fluid due to, suppose there is diarrhea, there is vomiting, there is severe dehydration. So in this condition there will be loss of electrolyte and loss of body fluid. So these conditions can give rise to non-hemorrhagic type of hypovolemic shock. Then coming to septic shock. What is sepsis? Sepsis means there will be a systemic infection. Systemic infection means the infection is also present in our bodies like blood. There is infection present in our body, in our blood, and multiple organ system is getting involved, right? So which are the organism, like the common organism which can give rise to this kind of situations? So Klebsiella, E. coli. So these are and some other gram negative bacteria, along with the gram positive, some gram positive bacteria, but mostly it is gram negative bacteria that leads to this kind of condition, that is septic shock. Okay, so after that we are going to move on to the cardiogenic shock. What is cardiogenic shock? It is due to failure of the pumping mechanism of the body. What is the pumping mechanism of our body? That is heart. Then what are the type of cardiogenic shock, you may ask? There are three types of cardiogenic shock, that is intrinsic, extrinsic and obstructive. What is intrinsic? That is intrinsic to the structure of heart. The intrinsic to the structure of heart means there should be a defect in the wall of the heart or conduction mechanism of the heart, that is MI or bundle branch block or AB block. So these are the conditions that leads to the shock which are cardiogenic in nature and intrinsic to heart. Then coming to the external type of extrinsic type of cardiogenic shock, the causes are like there should be some cause, that is there are some extrinsic factor that is compressing the heart, and for that reason the heart is unable to pump properly. So what is that condition called? That the condition can be seen in pericarditis, excessive fluid getting stored in the pericardial sac. So in that condition there will be definitely the heart will be compressed from the periphery, and the pumping mechanism is definitely going to be affected. Second one, pericardial tamponade, which can result due to stab injury or due to chronic pericardial effusion, right? So now the last one is obstructive type of cardiogenic shock. What is obstructive type? So obstructive type means there will be pooling of there will be a barrier or obstruction to the outflow tracts. Like for example, there will be pulmonary outflow obstruction, or there can be also systemic obstruction of aorta. So these are the condition where we can see cardiogenic shock which are obstructive type. Now let us move on to uh, the vasogenic shock. So in case of vasogenic shock, there will be pooling of blood inside our periphery or in our periphery. So what are the causes or subtypes of vasogenic shock? 1. Anaphylactic shock. That means there due to the like anaphylactic means there should be some allergic component, like generally I am saying. So due to allergy or something like that, the release of nitric oxide and histamine will be there, which will cause the vasodilation. Those things are vasodilators, as you already know. So that will cause the peripheral vasodilation, and it will result in the like the pooling of blood in peripheral vascular system. After that, let us move into vasovagal type of like vasogenic shock. So what does that mean? Like there will be vasovagal reflex, which will lead to a dilation of the blood vessel, which will lead to again pooling of the blood inside our limbs, and like mainly lower part of the body. It can actually happen in anywhere in body, but mainly the pooling result in the lower limbs. So that's why I am telling. Then there will be a psychogenic type of vasogenic shock. Psychogenic shock, that means in condition of sudden fright, or actually the literal meaning of shock, the actual fright condition, or something spontaneous condition, over excitement. So that can lead to also psychogenic shock. After that, there will be a neurogenic shock. That's it. This is the classification of our shock, different type of shock. Mainly I am telling this from the perspective of surgery and medicine. There may be some different classification given in other book, but yeah, this classification is the best classification you can learn, like you can write in your exams also. I hope you like this video. Like if you are going to discuss about the sign and symptom of shock, that will be based on how much percentage of body fluid is getting lost. So on that basis we can like divide the shock into 3 category: mild, moderate and severe. What is mild shock? Like less than 20% of the body fluid is gone. 20 to 40% body fluid if gone, then it will be called as a moderate shock, and severe shock will be greater than 40% of the body fluid is gone. So this is the classification of our the types of shock, again in a different perspective, to classify the sign and symptoms. So I hope you like this video. For like the other such informative video and like for discussion, general discussion about medicine field, you can follow my YouTube channel. So subscribe it and follow our Instagram page, the MBBS flashcards, for more such amazing videos. Thank you so much. Let's meet in a new video or next video. Tata.